Welcome to our first bite-sized video to support with understanding the Health and Care Staffing Scotland Act 2019. This legislation is applicable to all services listed in Section 47 of the Public Services Reform Scotland Act, which includes all childminders, not just those who employ assistants. The statutory guidance which accompanies the Act is clear on who this applies to, and this includes all self-employed workers as staff. As childminders, you have a vital part to play in providing the best possible outcomes for children. The service you provide is very unique, it's flexible and often tailored to meet the needs of different children and families. We very much value the hard work you do. This session aims to support your work and provide you with a brief overview of some parts of the Act applicable to the childminding sector. This video will be focusing on the guiding principles from the first part of the Act. Part 1 of the Act tells us about the guiding principles, and these apply to all social care services, including childminding services. The Act states, the main purposes of staffing for health and care services are to provide safe and high quality services and to ensure the best care outcomes for people who use services. The rest of the Act is all about making these main purposes happen. When we are considering this legislation and the wording in the Act, when it refers to staff, this includes all individuals working in the service providing care for children, which in most cases are yourselves as childminders. So when it states the main purposes of staffing, it is referring to the main purposes of the service being provided. Of course, when assistants are employed, this would also refer to ensuring the people employed in the service are employed in order to meet these main purposes of their role. As childminders, you should be considering how these guiding principles are used to develop and deliver your service and, when appropriate, making decisions about staff you employ as assistants. There are 8 headings on the slide that feature in Part 1b. These are the main principles of the Act and must be considered when arranging your service delivery in order to achieve the 2 guiding principles that were set out in the last slide. Most of these headings are similar to the current expectations, and I'm sure you will be able to identify areas of good practice within your own services in these principles. With the introduction of the health and social care standards and quality assurance processes you'll have in place, you will already be working towards the first principle of improving standards and outcomes for children. The second principle of taking account of individual needs is something many childminders do very well with their personal planning. Our personal planning guidance launched last year supports this principle. I know there has been some training available for childminders through the SCMA on children's rights and participation in practice, and promoting children's rights is something many childminders have spoken confidently and passionately about. We have seen many ways childminders have established meaningful ways of involving children in your services and supporting children to recognise their rights. All of this relates directly to the third principle of the Act. What we were keen to do is ensure our programme provided support for childminders, and for us that needed to be demonstrating this legislation in ways that you can see how this applies to you and your service. Childminding is unique and brings a valuable offering to children's care, play and learning experiences, so we've adapted the wording from the main principles here to show you how these affect your service if you're working as a sole childcare provider, and for those of you who have assistants, how they need to be supported. The adapted wording for each principle can be viewed on this slide. You can see the fourth principle here, for example, on the right-hand side of the top row, is about taking account the views of children and staff. We've reworded this to read, taking children's views into account and assistance if applicable. As childminders, you will know children in your care so very well, and you will be considering children's views as normal practice, and the wording here demonstrates how assistants' views should also be taken into account if they are employed. You will already be demonstrating through self-evaluation processes how you listen to and consider children's views, so it's just about ensuring views of staff are considered too where applicable. We have developed our hub page specifically for the different specialisms within the ELC sector, which has a dedicated section for childminding services. There is further support on each of the principles on the Hub page, with each principle linked to the statutory guidance document that accompanies the Act, so please do view the childminding section of our Hub page. One principle we wanted to draw your attention to is an addition to current legislation, that of staff wellbeing. Many childminders will work individually and independently with children and families, so it's extremely important you consider your own well-being in order to provide safe and high-quality services and to ensure the best care outcomes for children. Childminders, as professional childcare workers, have a responsibility to ensure that you're keeping your skills and knowledge up to date in order to be confident in your own practice to enable high-quality care for children. Our national guidance documents, Realising Ambition, and national frameworks including the Blueprint 2020, which documented the Scottish Government's vision for the expansion of ELC, all recognise that a high quality workforce is a key driver in providing high quality care. As childminders, you are your own workforce and are accountable to ensuring that your knowledge and practice is based on current research and up to date, which is an essential element of enabling high quality care. In terms of evidencing this and adhering to the legislation, this doesn't require further elements or processes. If assistants are employed, there will already be notes of any training or development opportunities provided for assistants and information about any internal discussions that you've had to work together to achieve the best outcomes for children. Whether this is reviewing children's personal plans together or documenting reviews to discuss children's next steps or progress. In terms of inspectors assessing this for childminders, we will be having conversations about how you're keeping your knowledge up to date and asking of any networking groups you're attending, such as toddler groups or childminding groups. These all contribute to sharing ideas and best practice and demonstrate what it means to be a reflective practitioner. When considering this principle for assistants, the focus is on staff well-being insofar as it affects the main purposes of providing safe and high-quality services and ensuring the best care outcomes for children. The important thing all services should be aiming for is that it's safe for assistants to raise issues without fear of retribution and that there's a culture of service improvement, transparency and open communication, whether you are working on your own or with others. We hope you found this useful. Please share with other childminders to support their knowledge and understanding of the Health and Care Staffing Scotland Act. Please use the Get Involved tab on the Hub page to send us in some ideas about your strengths, challenges and aspirations for the different principles. These will be collated and shared with other childminders in the form of word clouds. Please also go on to review our second Bitesize video, which discusses Part 3 of the Act.